Hello wonderful students, myself Dr. Maddineni Srinivas. The topic of discussion for this video will be Xeroderma Pigmentosum. So let us begin the discussion. By the end of this video, you are going to understand what is the etiology, what are the subtypes, what are the clinical features, investigations and possible management protocol for Xeroderma Pigmentosum patients. So let us begin our discussion. Subtypes, clinical features, management of Xeroderma pigmentosum. So what is this XP? We'll call it in short as XP. It is a rare autosomal recessive genodermatosis. What do you mean by genodermatosis? It's also called as phacomatosis. So these are genetic conditions which will present with skin changes. It is characterized by extreme photosensitivity, pigmentary changes, premature skin aging and high risk of malignant tumors due to the defective DNA repair. And what exactly is the problem with the DNA repair is, if you see the pathogenesis, you will understand that there is a problem, defect in the NER pathway, which is called as Nucleotide Excision Repair pathway. So this pathway usually removes the UV-induced damaged DNA parts in the skin. So the sunlight is going to throw the ultraviolet rays, which are usually going to damage the DNA. In you and me, in everyone, it's going to cause this. But the NER pathway is very active in us. It's going to take care of all these mutations. It will remove all these mutated parts and throw it away. But in the patients of XP, this is not happening. So these mutations are going to accumulate. This will ultimately lead to the carcinogenesis. Right? So there are various subtypes of XP. So A, B, C, D, E, F, G, these are going to have defective NER pathway. There is a very interesting variant which is called as XP variant or XPV, in which the NER pathway is normal, but the problem is with defect in the post replication repair. Because this is required for translation synthesis after the ultraviolet damage. So that is problematic in the XPV patients. Coming to epidemiology, the most common variant worldwide is the XPC variant, whereas XPA is common in the Japan and also XPA is associated with neurological features. Yes, you heard it right. These patients are not only going to have the skin changes, they can also have the changes in the eyes and also in the nervous system. Right? So coming to the clinical features, obviously the first and foremost we are going to see the cutaneous features. Early on we can see the children, that is infants, to have erythematous skin along with bullae formation on the sun exposed areas even after minimal ultraviolet exposure. And there can be possibility of this progression happening in the form of diffuse freckle, that is hyperpigmented macules which are present in a diffuse fashion over the body, right? And these patients are also going to have very dry skin, that is xerosis. There is a reason why this condition is called as Xeroderma Pigmentosum. So because pigmented lesions are there and the dry skin is there in these individuals. And there can also be skin changes in the form of atrophy. And so that is the reason why this term called as poikiloderma is very famously used in the conditions wherever there are three changes which can be seen in the skin. What are those three changes? ATP. What is ATP? Atrophy of the skin, telangiectasia in the skin, that is dilated blood vessels, and pigmentary skin changes. This pigmentation is dyspigmentation, that is both hyperpigmentation as well as hypo and depigmentation will be present in the same individual. As you can see in this picture, you can see that there are hyperpigmented skin changes along with hypo or depigmented skin changes. Atrophy is also there, telangiectasia is also there. So all these three put together we call it as poikiloderma, and there are various skin conditions which will present with poikiloderma. One of the differential is XP. Of course, there can be also chronic radiation dermatitis because of the ultraviolet damage, actinic keratosis and wrinkling of the skin because of the atrophic skin changes. And this is the most important part, the carcinogenesis part. These individuals are going to have 10,000 fold risk of non-melanoma skin cancer and 2000 times risk of melanoma. And what is the age group? NMSC is seen in 8 to 9 years, whereas melanoma is common in 22 years. There is a median age of occurrence of this malignancies. Like I have told you, there can be also eye changes. Photophobia will be there, photosensitivity will be there, photophobia will be there. Severe conjunctivitis, dry eyes can be noted. and eyelid lentigens, loss of eyelashes, ectropia and symblepharon can also be present. And if you clearly see, this picture is actually showing this corneal opacification, and we can also see the vascularization of the cornea. So these are all the possibilities, and even nerves can also be affected in the form of progressive neurodegeneration, and also the individuals can have deafness, sensory neural hearing loss, microcephaly, spasticity, and there can be many other changes in the nervous system. One of the syndromes you need to remember is de Sanctis-Cacchione syndrome, in which it is a severe variant of the XP associated with microcephaly, dwarfism, hypogonadism and mental retardation. So this is the presentation of these children. Usually you can see they are going to have this dwarfism, microcephaly can also be there, and if you happen to do a MRI, there can be parenchymal volume loss and cerebellar atrophy and white matter gliosis. So all kind of progressive neurological degenerative changes can be seen. Coming to the diagnosis part, so mostly it is clinical diagnosis, but for confirmatory purposes, UDS, that is unscheduled DNA synthesis, can be used. Basically, this measures in the cultures of fibroblast lymphocytes after the UV radiation. So UDS is going to be very low in the XP A to G variants, and it's going to be normal in the XPV variant. So in such case, what we can do is cells can show extreme ultraviolet sensitivity when they are incubated with caffeine. So genetic sequencing can be done if you suspect any specific genetic mutations, and prenatal diagnosis can also be done. This is also a very important question, prenatal screening in dermatology. So amniocentesis or chorionic villus sampling, CVS, for DNA analysis, or even UDS, unscheduled DNA synthesis assay, can also be done. Coming to the management strategy, the most important component is the protection, prevention. That is absolute avoidance of the ultraviolet light, protective clothing, broad brimmed hats, and UV blocking, window films, sunscreens, all this must be used in these individuals. And this is actually one individual having this XP, and they were in the world tour, and you can see they are using very high level of protection against the ultraviolet rays of the sun. Chemo prevention and topical therapy. So these individuals, because they are having high chance of development of malignancies of the skin, so oral retinoids can be utilized, high dose isotretinoin or acetretin, to prevent the malignancies of the skin. And also there is this topical T4 endonuclease 5, which is available in the US market but not in the Indian market. Apart from this, topicals like 5-fluorouracil and imiquimod can also be used, right? And surgical and systemic treatment modalities are also very important. That is, surgical excision of the malignant lesions is very crucial, otherwise they can metastasize and it can lead to very poor prognosis of the patients. So here you can see this is a picture which is showing the malignancies which are present and identified, and they were also removed surgically. Avoidance of chemical carcinogens, that is smoking, should be strictly avoided. Multidisciplinary care is very much required because there can be also eye and nervous system changes, and of course genetic counseling is also a must to identify the possibility of the same XP happening in the progeny, in the offspring of the patients. Okay, I hope this video was helpful. So please do hit that like button and do subscribe for more such videos on a regular basis, and comment if you have any doubts, and do share this among your friends. Thank you so much. Happy learning. Bye bye.